We're here today because tomorrow is the beginning of a journey that will end with almost 900,000 Pennsylvanians finally having the peace of mind that comes from affordable health insurance coverage. Within the next few years, these Pennsylvanians will no longer be at financial risk if they are sick or injured or have a chronic illness. October 1st begins a 6-month open enrollment period for health insurance coverage through the Federal Competitive Health Insurance Marketplace, or exchange. And we're here today to encourage all Pennsylvanians to pay attention to this important development.
In our region of South Central Pennsylvania, a health assessment by area hospitals shows that 1/3 of our residents are uninsured. When people are uninsured, they often ignore or mistreat pressing health problems, and those health issues take a deep human and financial toll on our communities. We look forward to a future soon when all of our neighbors get the care they need and deserve. Yes, your pre-existing conditions are covered. No, your insurance company can't drop you when you get sick. There are no longer annual or lifetime caps on coverage of essential health benefits, and basic preventive health care is free.
And now for a few quick facts about Pennsylvania's marketplace. 8 insurers applied to offer products in the exchange. The 4 Blue Cross plans, Aetna, Geisinger, Health America, and UPMC. We have learned that there will be a total of 56 qualified health plans. They have been approved for Pennsylvania. Pennsylvania's plans have the 10th lowest premiums in the country.
Mental health is just as important as physical health. I think we all know that in our individual lives, or our friends' lives, our families' lives. Society is catching up to that. And one sign of society catching up to that is that mental health coverage and coverage for substance abuse disorders will be provided by all the qualified health plans in the insurance marketplace.
And for the over 65 population who is enrolled in Medicare, the key to the ACA is folks have to do nothing as of tomorrow. Guaranteed Medicare benefits will not change because of the ACA. Individuals who are on Medicare should stay on Medicare, should be on Medicare, and they do not have to go into the exchange to look for health care insurance. In fact, the ACA has improved Medicare in a couple ways. One, by the process of eliminating the Medicare prescription drug donut hole. In addition, for Medicare beneficiaries, preventive care services from their family physician are now covered with no copays or deductibles. So individuals can go to their doctors once a year, get those preventive screenings that are so important to keeping them healthy, and they don't have to pay a deductible or copay. Many people between the ages of 50 and 64 have chronic conditions or pre-existing conditions that they've had a lot of difficulty obtaining health insurance up to now. Starting on January 1st, 2014, it's these individuals who will be able to get their health insurance through the exchange.
For 13 years as a person with a pre-existing condition, to live without insurance, if you have any idea whether it's someone you know with lupus, leukemia, cancer recovery, diabetes, HIV/AIDS, if your immune system is affected already, if you have stress in your life, exhaustion in your life, worry about no health insurance. It's a proven fact that some people as they age do not live as long if they do not have this particular safety net that will happen tomorrow. I hope that you understand how powerful, how life-changing this will be for people who have thought that they would die without ever having insurance again.
As we pass this next milestone in healthcare reform and this first open enrollment period begins, women will now be able to enroll in health insurance plans that are affordable and provide access not only to critical care, but also routine preventive health screenings that many women currently in Pennsylvania do not have access to. And starting tomorrow, women can enroll in plans which will begin January 1st, 2014, and being a woman as of that point will no longer be considered a pre-existing condition.
We welcome the opportunity. We know in our health centers we have seen the need grow over the years. Just since 2005, we had 123,000 individuals that were uninsured come into our health centers. That number increased to over 180,000 just last year. We know that the need is not going away, and we're hopeful that this opportunity will provide people the information and the opportunity that they can to purchase insurance and then be able to seek the access to care that they need and hopefully stay healthy and get well moving forward.
We are not all experts in the Affordable Care Act, but we are all experts in our families' needs. And for families, it's important to go to the exchange and shop for what your family needs.